Now, moving on to the stem cell transplants. So once we complete that 4 to 6 cycles of treatment with the 3 drug combinations, patients who are considered to be eligible or safe to proceed to transplant will undergo typically an autologous stem cell transplant, which is using the patient's own stem cells. In theory, it is not really a transplant because you are using your own cells. Unlike the allogeneic transplant where you are using cells from a donor who is a good match but may or may not be related. I would say 95% or higher percentage of the transplants in myeloma are autologous stem cell transplant, and most centers do a very selected number of allogeneic stem cell transplants. The reason why we do autologous transplants because clinical trials have shown that patients can live longer when they receive a transplant. Now, the stem cell transplants a two-step process. The first step is collecting the stem cells, and that is a procedure called apheresis. And the second step is giving the high dose of chemotherapy that allows destruction of the majority of these myeloma cells, followed by reinfusion of the cells that were collected through the apheresis procedure. There are times when patients may elect not to proceed to a transplant, but rather collect the cells and store it for future purposes, and then continue with the treatment they are currently on. And that is an approach that's called collect and store. So how do we collect the stem cells? It's typically done through a catheter that's placed into a larger vein in the neck. The way we do that is by giving injections of growth factors called GCSF or Neupogen. After 4 to 5 days, we measure the number of stem cells in the bloodstream, and if it's insufficient, then we give a second medication called plerixafor. Sometimes people can also get chemotherapy, and when they recover from chemotherapy, the stem cells can be collected. And different centers have different approaches. But essentially, the machine, what it does is it separates out the stem cells, and all the other cells and the blood are returned back into the bloodstream through a different vein. Now, once the stem cells collected and you proceed to transplant, we give a mega dose of chemotherapy of a drug called melphalan. It's given IV, and after a day or two of that, then we reinfuse the cells. Now, this high dose of chemotherapy, we hope, would destroy the majority of the myeloma cells, even though it cannot get rid of 100% of them. But unfortunately, that also gets rid of the normal cells, and the normal cells takes about a couple of weeks to recover from the stem cells that have been infused. During these 2 to 3 weeks, these patients are followed very carefully and closely. Some centers like ours do transplants as an outpatient. Some centers do it as an inpatient. Nevertheless, there are some common risks, increased risk of infections, risk of bleeding. Transfusions for red blood cells and platelets are often needed. There can be a variety of side effects, including mouth sores, diarrhea, etc., from the transplant, and these all need to be closely managed. In about 2 to 3 weeks, the blood counts recover. Patients go home after the transplant. In about 2 to 3 months after that, we get patients back and we do additional testing to make sure the myeloma is under control, and at that time we often start them on maintenance. Once the patients finish about 6 months or so from transplant, we often start vaccinating them for common infections.